All right, ladies and gentlemen, I am so excited to have Dr. Robert Fullilove, Fred Hutchinson Cancer Research Center. We're talking about, the COVID-19 and the possible vaccinations. Ladies and gentlemen, it is our pleasure to work with expert advisor to the COVID-19 Prevention Network, Columbia University Associate Dean and Professor, Dr. Robert Fullilove. Good morning.
Good morning.
Hey, thank you so much. We've been talking about COVID-19 on this show like every single day since the pandemic began, and trying to make sure that our listeners know what we're dealing with and how to stay safe. Recently, there's been a lot of news about an effective vaccine that seems hopeful, but we have a whole lot of questions, and you are an expert on public health. So let's start with, why has COVID-19 hit the Black and brown communities so hard in the first place?
Well, there are a number of factors, but maybe the most important is that we are the folk who are most likely to be working in settings where what we do is face the public. That means that our circulation, our movement, what we do at work is likely to expose us to the virus. Then we tend to live in segregated communities where there's a substantial amount of overcrowding. We got folk living on top of each other. And if one of the ways to keep yourself safe is to practice social distancing, well, in a lot of our households, that's really, really not possible. And then maybe the biggest thing of all is that COVID-19 really plays havoc for folk who are struggling with a lot of health conditions that are very, very present in our community. Obesity, hypertension, diabetes, all of these things combined with an infection with this virus will produce not only a great likelihood that somebody will be hospitalized, it also increases the likelihood that if they are sick and in the hospital, they'll die. So there are factors that are unique to our presence in the United States. The fact that we are the victims of a kind of a structural racism that keeps us exposed to situations that are risky and that threaten our health. This is one of the major reasons why we're suffering more from this virus than just about every other ethnic group, with the possible exception of American Indians.
Dr. Fullilove, can you explain what all goes into developing a vaccine?
Well, there are 3 stages to the development of a vaccine. First off, you have to have some molecule, some essence that will be effective against the infectious agent, the pathogen, the bug that we're trying to deal with. You got to make sure that it works. Typically, we do this by testing them with mice or with computer models. The second thing you have to do is make sure that it's safe for human beings. So in the second phase of vaccine trials, part of what we do is take a small group of folks, we give them the vaccine, and we just look to see whether or not they're going to get sick, whether or not they're going to be side effects. When we're clear that the vaccine has the potential to work, and when it's clear that it's likely to be safe, we then administer it in phase 3 trials to a very, very large sample of individuals, typically 30 to 40,000. That's where we are today. We're at that phase where we have a number of vaccine candidates. It looks as if they work. And the Pfizer candidate appears to be not only working, it appears to be extremely effective in preventing infection from this virus. 90% is what I've seen quoted as its effectiveness. That means that you have a 9 in 10 chance, if you're exposed to the virus, to not get it. A lot of work needs to be done to make sure that these early effects and these early results are really for real. But if they are, then we can expect to see a vaccine being distributed to healthcare workers and other people who are in situations where they're exposed to the virus all the time. You can expect to see them getting the vaccine maybe as early as the spring.
Dr. Fullilove, can you explain the difference between the antibodies and the T cells?
Well, antibodies are basically the body's way of fighting an invasion from a pathogen, from a bug, from a germ. So the body's immune system has a number of different elements to it, a number of components. One is the T cells, the T helper cells. Those are the ones that get mounted in the midst of an immune response to an invading pathogen. And those are the ones that sort of lead the body in its efforts to clear whatever bug is making us ill. So they're an essential part of the immune reaction. And that's what we look to see, whether or not we've got good responses when an invading organism is present in your body.
Mm-hmm. Now, Dr. Fullilove, you know, in the Black community, we got some trust issues when it comes to vaccines. So, can you tell the audience why we should trust it?
Well, part of the reason we should trust this is that if we're the ones who are taking on the biggest burden of disease, it's in our best interest to keep ourselves safe by using as many different tools as we can to assure that our families and that we ourselves are going to be okay. It's very clear that part of what we have to do is more than just wear masks and more than just try to practice social distancing. If we've got an effective vaccine, it will reduce the likelihood that any of us or members of our family will be ill. There are a lot of trust issues because throughout the history of Black people in the United States, literally beginning with our experience with the rather tragic institution of slavery beginning in the 1600s, we have been the subjects of all kinds of medical experiments. We have been the victims of all sorts of malpractice. There are many, many studies that have demonstrated a kind of a callous disregard for life in our community. And we know about these things. They're part of what might be described as our racial memory. So when anybody from government tells us that they've got something that's good for us, we're reminded of slavery days. There's a man going around taking names. And we are naturally suspicious, as we have every right to be, because we have not always been treated in a fair manner by the medical or public health institutions of the United States. Figuring out how to overcome that is our challenge.
All right, real quick, we got to run. Now, if our listeners have any questions and want more information, where should they go?
Well, there should be some information that's provided by the Fred Hutchinson Center, which is coordinating all the efforts to make sure that when people have questions about these vaccines, they can be answered. There are a number of call centers that they can dial up. I don't have them right in front of me, but I think you will get some.
We'll post it.
Very good.
No, we will definitely post it. I am so excited, and thank you so much for coming on with us this morning, giving us all of that information. Ladies and gentlemen, we've been talking with expert advisor of the COVID-19 Prevention Network. Please help me thank Dr. Robert Fullilove.
Yes, sir.
Thank you so much, sir. We appreciate you.
Thank you.